Welcome to Docs on Call, brought to you by Northeast OBGYN, with your host, Liz Schatzline.
Good evening and welcome to the program. I'm Liz Schatzline. Tonight we are going to discuss pelvic prolapse. Now, what is that, you say? That is a problem that afflicts a lot of women, but it can be remedied very easily. And tonight we're going to learn how the Vinci Robotic System can put an end to your pelvic prolapse problems. I'm very happy to welcome back to the program tonight Dr. Geoff Cly. He is an OBGYN practicing in Fort Wayne. Thank you very much for coming and joining us again.
Thank you very much.
And as I said, pelvic prolapse affects a lot of women, doesn't it? What is it exactly, Dr. Cly?
Well, what it is when the pelvic tissues, usually uterus and vaginal tissues or bladder, start to descend. Starts usually after having several children. Even without children, it can happen in 30s, 40s, 50s, and then really significantly in 60s and 70s. Most women don't talk about it. It's kind of embarrassing, but it does happen to a lot of people. The good news is there's a lot of things we can do to prevent the problem or fix the problem before it gets to be where it affects your quality of life.
Now, how does it affect your quality of life, Dr. Cly? What would it do to you that would be so miserable?
The initial stages, you might notice a little bit of leakage when you cough, laugh, or sneeze, or a feeling of pressure in the pelvis, or pain with intercourse, or at the end of a day, you might feel this tugging heaviness down the pelvis, especially women who stand for much of the day. Gravity will just kind of tug on the pelvic tissues, and then by the time they come home, they find they may even have to sit down or lie down to help relieve some of that pressure and pain.
Yeah, okay. Now, you said this is really a problem women should not be suffering with, though, because there are so many things you can do, and the Vinci Robotic System has been very helpful in this regard, hasn't it?
It's phenomenal. What the Da Vinci allows us to do is do very small incision surgery as a 23-hour outpatient, fix the prolapse, and correct it by lifting the tissues back up using those small incisions inside the patient's body, so women get back to life faster. And what we're looking at is the Da Vinci system here, and the doctors on the left operating the 5 to 7 millimeter instruments, which are going to be inside the patient through 5 small incisions. And the instrument moves just like the human wrist would move and like human fingers. So when I'm operating the instrument, I feel like I'm actually inside the patient looking through the 3D virtual reality system. So we act and we work on a microscopic level, and that's why we don't cause a lot of pain, discomfort, and there's very minimal bleeding with this procedure.
So even though you're actually away from the patient, you're not standing over the patient when you're doing this, you say it's much more accurate.
Oh, much more accurate, because what we're seeing right there, the sutures and the stitches we're looking at are smaller than a human hair. But when I'm looking at through the machine, it's 10 times magnified. So I'm working at such a microscopic level that it's not causing a lot of damage to any tissue around that area. So the inflammation is less, the pain is less, the recovery is faster.
Wow. I do want to mention that Dr. Cly will be answering your questions tonight. If you have questions about pelvic prolapse, please call us, 483-8331. We would love to hear from you tonight. Pelvic prolapse robotic, Da Vinci Robotic System, is it pretty complicated, Dr. Cly, to learn?
It is a little complicated, and I guess the video games I played as a kid paid off.
Here's where it comes in handy. We knew there was a reason.
It takes some training and it takes some time, and I started by doing the Da Vinci hysterectomies, which I still do a lot of.
Right, and we've talked about those on the air before.
So I've done over 200 cases of the hysterectomies. Usually after a doc has done so many cases and they really get skilled with the Da Vinci, we move into we can do the pelvic prolapse procedure, because there's some really intricate, detailed work around some of the larger blood vessels and ligaments inside the body. And so right now I'm the only one in town so far that's doing this with the Da Vinci. We've got some of the other doctors in the process. They'll probably be ready to do it in the next 6 months to a year. But the more doctors we can train, the better the patients do, because the patients find that this procedure gets them back to life within 1 to 2 weeks and very minimal discomfort. And so they feel so good, and the longevity of this repair is the best that can be, because we're working inside the body without infection, and the history of this repair is over 50 years. But in the past, we had to make a big incision, and it wasn't worth that big incision to do this repair. We do use a mesh, and I brought some of the mesh with me, much like people have heard hernia surgeries done with mesh. And it's the same type of mesh, and we put this inside and suture it inside the body, so we're not cutting open from the outside, and we're able to attach this to the pelvic tissues, lift up where they should be, and then we anchor it to the ligaments. And
so this is what holds everything in place then?
The tissues grow in through those little weaves, and when a patient is healed after 6 weeks, I can't even feel the mesh. It becomes part of their own body.
Wow. This is very light. Very, very light.
Exactly. Exactly. Because we don't want it too thick, because you would then know that it's there. It could cause problems. So it's very light and incorporates into the patient.
Okay, we have a caller waiting.
Great.
So let's go to the phone lines. Jennifer, good evening and welcome to the program. You're on the air. Hello, Jennifer? Did we lose you?
No, I'm
Jennifer, are you there? Hi, Jennifer. Go ahead. You're on the air.
Yes, my question is, if you was to go in to have a regular exam, could you tell right then and there that a woman has this problem?
Oh, good question.
Yeah, good question. Yes, we can tell when we're doing the exam, and there's a couple different ways to tell. One is just by looking. One is by feeling. When we do the examination, we feel inside. We can tell how mobile or how descended the tissues are. At the same time, some women, when they're laying back, it's not as pronounced. So it is important, if you notice or think something's happening, let your doctor know, because he may or she may ask you to cough or bear down, which will then allow the prolapse to show itself, and so we can see exactly what's going on. Patients feel uncomfortable, and they usually are embarrassed if they leak or I see the prolapse, but that's actually what I need to see. So I always tell them, no, I'm glad that you did have a little drop of leakage, because now I can tell you how we can go about getting that corrected.
Okay, so women out there who are buying adult undergarments and things to wear, this takes care of all of that, right? You won't have to do that anymore?
It sure does. And I'm a big proponent, though, of non-surgical methods. So one thing we do talk about, and not focusing on tonight, but is the physical therapy, the muscle strengthening to try and stop the prolapse, fix the prolapse, lift it back up without surgery. And in the early stages, I had a patient I've known for a while today come in, and she's very young, 41, 42. She's just starting to have symptoms. So we've had her start some physical therapy with physical therapy specialists in town, so women in town who are specially trained. And I'm betting that she will be able to stop the problem, fix the tissue, and probably not need surgery. So I'd always recommend the non-surgical method first.
That's good news. Okay, we've got another caller waiting. Kathy, good evening and welcome to the program. You're on the air.
Hi.
Hi.
Hello.
I was wondering if this is a procedure that Medicaid will cover.
Absolutely. It's an excellent question. And all the insurances cover this procedure and have no problem, because it is indicated. It is a legitimate thing, and it does allow the patient or you to get back to your life faster, less risk, less post-operative complications. And so in the end, it's a lot less for them to cover this procedure than to do some of the older procedures where you're in the hospital for 3 to 5 days and you have a higher risk of complications from those large incisions.
Okay. If a woman does let her pelvic prolapse go and it gets worse and worse and worse, is that woman more prone to, say, urinary tract infections and that kind of thing? What do you see if you let it go?
Yeah, exactly, and I'm one of the guiltiest there too. I don't like going to my doctor. And so people come in and say, oh, doctor, I should have been in a couple years ago. I don't blame them. I think most of us medical, we don't like going to see ourselves.
We like to procrastinate.
Exactly.
Yep.
It's just human nature, but you're exactly right. After the bladder drops, then you can get more urine infections because you never really get rid of all of the water.
Right.
And so the bacteria are more likely just to hang out in the bottom of that area, which doesn't get drained out.
Okay.
So if you've let it go, come on in. That's the majority, actually, what we see is women say, I should have come in a while back. We can still start with the non-surgical methods. They may be less likely to work depending on what the situation is, but we still should go evaluate it properly.
Okay, we have a caller waiting. Right. Bobby, good evening and welcome to our program. You're on the air. Hello, Bobby?
Yes.
Yes,
Yeah.
go ahead. We can hear you.
Yeah, I had a hysterectomy when I was 22, and I was wondering if this surgery would be good for me because my bladder does not just leak a little when I cough or sneeze. I mean, it goes a lot, and I have to wear the pull-up, and it is embarrassing.
Yeah.
Yeah, you're a great example, Bobby, and thank you for calling, because a lot of women have this condition, especially after hysterectomy. And it is true that after hysterectomy, pelvic prolapse is more likely, even with the best intention hysterectomy and the best doctor, because the tissues have been altered. And it affects the quality of life, as you've found out, that it's hard to go somewhere, it's hard to exercise, which can then affect your weight or how you feel about yourself. So this is a great procedure for someone with a hysterectomy. You may need this, you may not need something as much as this, because maybe it's just part of your bladder that needs to be lifted or corrected, or maybe even some of the muscle strengthening and some of the other therapies we could try would work. So I'd absolutely call your doctor, come on in, get it checked out so that you can start living the way you want to live again.
Now, when you use the Da Vinci on someone for this procedure, where would you enter, Dr. Cly? Where's the incision, so to speak?
Great question. We make small incisions around the belly button, just above the belly button, to the left and the right of the belly button, and then 2 more small ones lateral to that.
Now, when you say small, you mean small, right?
I mean small, smaller than a dime.
Okay.
5 to 7 millimeters in size, so it's pretty small.
Wow.
Yeah, and then what we do is we work through those incisions. In the mesh, we actually insert through those incisions.
I was just going to ask, it was my next question. I thought, okay, how do you get this through that?
Yeah.
But you can do that. Yeah.
And we actually have a device, if we need to take the uterus out, if that's also needed to be done, we can take the uterus out through those small incisions with a device that will remove it, so we don't have to make big incisions to do the procedure anymore.
Okay, very good. We have another caller waiting. Gina, good evening. Welcome to the program.
Hello.
Hi, go ahead, Gina. We can hear you.
I was just wondering if you were heavy set, you wouldn't be able to have that surgery because of the weight gain, isn't it? Would interfere?
No, great question, Gina. The Da Vinci system is great for women who have extra weight or are heavy set, because we're working through these small incisions through the tubes that you may have seen on that picture, and they have extra tubes that have special lengths on them for the heavier women. So for heavy women, that's one of the things that's been phenomenal for Da Vinci, even for hysterectomies, because heavy women don't have to be cut open anymore, because we can use the little extra length tubes, reach the tissues, and the heavier patients who are at risk for more problems, sometimes because of diabetes or the challenges with their heart, they do exceptionally well. And one of my first patients was a heavy patient. She was about 400 pounds, and we did this procedure. And the next morning, I was a little late getting in to see her. It was about 10, 11 in the morning. She was sitting on the side of the bed. She'd been there since 9 o'clock. She was mad at me because I wasn't there sooner, because she was ready to go home fully dressed.
She said, get me out of here. So she was feeling very well.
Fantastic. And that was one of my eureka moments when I said, wow, this is going to revolutionize medicine, because otherwise she would have had to have been in the hospital for up to 5 to 7 days with a lot of challenges. And she did so well. So it does work for patients thin, thick, heavy.
Okay, very good. We have another caller waiting. Carolyn, good evening. Welcome to the program.
Good evening.
Hello.
My question was, I have frequent urination when I get out of bed at first. If I am out in the car and going to the grocery store, if I just get up from a chair. And I was wondering if that would help of what you're talking about.
Have to determine what exactly the source is. Frequent urination would be overactive bladder, and that would not be a surgical thing that would correct it. But if you have a weak urethra, or urethra has dropped a little bit, it could be because when you get up, the droppage of that tube or the urethra coming out of the bladder is what's leaking. So that this type of a procedure or something similar actually would help you with that condition. Sometimes women have both, frequent urination and overactive bladder with the leakage. So whereas maybe a procedure or the therapy might help, you might still need to look into some dietary alterations or some medication to relax your bladder.
Okay, all right, but she needs to be seen by a physician,
Yes.
first of all, to even determine what her problem is.
Yes,
Okay,
yes.
we have
Would
another
that
call.
mean
Oh, go
I
ahead.
would come to you or one of the doctors there?
And thank you for asking. I would be happy to see you. And and you can say I didn't plan this lovely lady
This
to
was
call.
not a plant, no.
Yes, but anytime, please call the office. We are always accepting new appointments. And
Your name, please?
It's Dr. Cly, C-L-Y, from Northeast OBGYN. And thank you very much for letting me do that plug.
Thank you.
All right, we have another caller waiting. On the phone lines, we have Debbie. Good evening. Welcome to the program.
Hello.
Yes, my question is about Rectocele, if pelvic exercises can help with that, or would the surgery you're talking about be able to repair?
Great question, both, Debbie. Definitely the exercises to start strengthening those muscles. And if they do enough to where you no longer have a problem, that's fantastic. Many women have struggled with constipation for a lot of their lives who have Rectocele. So that's also something to make sure that if you are having some constipation, to soften the bowels so that they're not putting a lot of pressure in the backside of the vagina where that Rectocele is. And then if the physical therapy and affecting and changing your diet doesn't help, then this type of procedure would work very well. The nice thing also about this procedure is it works from the inside, so there's no incisions in the vagina, and that's where we've had higher problems with infections, pelvic pain, painful intercourse, and postoperative complications from those vaginal procedures. And so this is not a vaginal procedure, and it works great because it does it from the inside out.
Right, you're not even going there.
Right.
Okay,
Right.
very good. We have another caller waiting. Mary, good evening. Welcome to the program.
Hello.
Hi, go ahead.
Yeah, I had a hysterectomy when I was 38, which is about 1976, and they supposedly tied up the bladder then because, you know, when I would sneeze, I would leak. And I still, when I sneeze now, it doesn't leak, but I have to wear pads I have to change it 2 or 3 times a day, maybe more, because I just can't hold it. And I was wondering if that would help me.
Is that pelvic prolapse, Dr. Cly?
Yeah, what you had done was a procedure that we don't do anymore because of the new techniques and the new instruments and meshes. You had a procedure that lifted the neck of the bladder, and what that does is when you cough, it holds your pressure back so that the urine won't leak out. But the tube coming out of your bladder has weakened over time. So that's why you're still leaking, though, at other times, because that tube, the urethra, is weak. And the bladder slings, which is kind of like this procedure, but actually smaller and easier, and can be done in 20 minutes to 30 minutes as an outpatient, could take care of that problem. So that way you're truly not leaking anymore. And most docs in town do that, and some of the urologists do that as well. If it's combined with pelvic prolapse, then I would definitely make sure that you also talk with the gynecologist. If your bladder's still lifted and it's just the leakage from that tube, a urologist would work, and you might not even need surgery. There are a couple procedures they can do in the office to tighten up the urethra.
Okay, but it sounds like she needs a full workup first and see where they stand.
Exactly.
Okay, very good. We have another caller on the line. Rachel, good evening. Welcome to the program. Hello, Rachel? Are you there, Rachel?
Yes, I am.
Oh,
Hello.
Hi. Go ahead. We can hear you.
Okay. My question is if you go through physical therapy and you strengthen up the muscle to where you don't have to go through with the surgery, is it something that you have to continuously go through physical therapy to keep those muscles strong, or is your muscles going to eventually go weak, like, say, when you're 60, 70 years old?
That's a good question, yeah. How long do you have to stay with it, Dr. Cly? That's a good question.
Yeah, you're exactly right, Rachel. And when you stop doing the exercises, the muscles do weaken, and then the problem comes back. What the physical therapists I found helps is they can help you incorporate the exercises into daily life so that you're automatically tightening up and strengthening when you don't even realize it. When you bend down, when you lift, when you do certain daily activities, you just naturally start to do that. Sometimes with like body posture, for example, sometimes you just do it the right way for so long that you don't even think about it anymore. That's the way to kind of make it last until you're 60 or 70. But if women who stop doing the exercises, everything will weaken. And once the pelvic muscles weaken, then the attachments of the muscles weaken. Once those attachments weaken, then there's strengthening won't lift it back up. So what you want to do is keep the muscles at least strong enough so that you're not going to weaken those attachments, which attaches the muscles to the bones.
So if you don't use it, you lose it.
Yep.
Literally.
Yes.
Literally you lose it.
Yes.
Okay, thank you. We have another caller waiting. Barbara, good evening and welcome to the program. Hi, Barbara.
Hi.
Hi, go ahead.
My question is, what does the doctor think about a pessary to wear for this problem?
Oh, what is that?
Yeah, a pessary is a object like a donut or a cube that's kind of rubbery that we fit to the pelvis that a woman puts inside, may leave it inside for a few days, takes out and changes it, that lifts everything back up inside without doing surgery. What I have found over the last 10 years is most women who are active and healthy do not like the pessaries whatsoever. And so I offer pessaries, but 99% of the people don't want to do them because they're kind of uncomfortable. It's not fixing the problem, it's taking the pessary, pushing it inside, expands inside the vagina, and then holds the tissue inside. They are very good for someone who can't have surgery because of medical problems. And so yes, I agree. Think about the pessary, and it's okay to try the pessary, but most women just find that it's not comfortable at all.
Okay, all right, we have another caller waiting. Lee, good evening, welcome to the show. Hi, go ahead, we can hear you.
Good evening. I had a hysterectomy years ago, and I was wondering if you would have this pelvic prolapse, would it cause you to have a lot of lower back pain?
Oh.
Excellent question, and that's one of the big complaints women have is that as the prolapse drops, it pulls on the lower back. And so they find a tremendous improvement in lower back pain. And that's kind of that heaviness. Also at the end of the day, or if you've been up, once it's pulling, that's when that back pain gets worse. So if you find that your back pain is after you've been standing for a while and you have some of the other symptoms, that definitely would make a big difference to get that corrected. Whether surgery or whether muscle strengthening, but correcting the problem is how to fix that. And most people think frequently that it's the uterus is causing the pain. It's actually just the pelvic tissue falling in general, not just the uterus causing the pain.
Okay, all right. We're going to try to get another caller in. Good evening, are you there?
Hi.
Hi,
can you hear
go
me?
ahead. Yes, we can hear you. Go ahead, caller.
Hi, I have 2 fibroid tumors in my uterus, which is called menorrhagia, and they are recommending that I do a procedure called a novissure, but my uterus is extremely large because of these tumors. And I'm wondering, because there's no guarantee that it's going to work, is it worth doing this?
Great question. Fibroid tumors are benign growths in the uterus that cause cramping and bleeding. And once they get to a certain size, they will destabilize the uterus and you get heavy bleeding along with pressure and pain. If you are away from early and away from menopause, they will continue to grow until you go through the change of life. And so the novissure ablation works very well, but you're right, it is temporary. And if you're not close to menopause, at some point you will probably start bleeding again. And so with 2 large fibroids, it is probably going to be temporary, and you probably will have to have a hysterectomy at some point. The nice thing about the Da Vinci system is we take out fibroids and hysterectomies with fibroids through these small incisions. So we did one, Dr. Kennedy and I, a couple months ago where it was about the size of a volleyball. And we were able to take it out using the Da Vinci, and she went home the next day. And that's why this technology is so fantastic. So the novissure device, though, could work for you if it's a time in your life where either you can't take off from work, you can't take a week or 2 off to be sick right now, whether it's school or your children or just life. So look at the NovaSure as a stopgap measure with potential long-term results, but not forever.
Now, I know people out there are wondering, Dr. Cly, how did you get a volleyball through an incision about that big? How do you do that?
The device we use is kind of like an apple core device, and it's the size of a quarter, a long tube, and it just removes the uterus, taking apple cores out of the uterus until we've got the whole uterus outside of the body.
Okay.
And sometimes it takes as long as it did to do the surgery, but at the end of the case, the patient feels wonderful.
Okay. We want to talk about a seminar that you have coming up. If people have more questions about this or would like to learn some more about it, tell me what's going on.
I'll be doing a seminar on Tuesday, 1 week from today, at 7 o'clock at our office on Southwest Carnegie Boulevard, off of Illinois Road, talking about pelvic prolapse. So it's free, open to the public. Patients, family members, or friends can come, and you don't have to be a patient to attend. But we're trying to educate the public, let you ask some questions and answer your questions. And usually it lasts about an hour. So most people walk away really having a better understanding of what's going on and maybe what they can do next to get their quality of life back to normal.
Okay, and women should not be embarrassed about this problem, right? You see this constantly, all the time. It may be a big deal to the woman, but you see it all the time.
All the time, and so we just want to. I want to help get you feeling back to normal, get you back to your life. And we all want to do the same thing. Okay.
Dr. Geoffrey Cly, thank you very much for coming and joining us and talking about this exciting things going on in the Da Vinci robotic world. Thank you for being here for this edition of Docs on Call. I hope you join us again next week. Dr. Stephen Hatch will be here to discuss pain management therapies. Until then, I'm Liz Schatzline. Good night.